back.
Thanks to the bold and decisive action we've taken since January, I can stand here with confidence and say that we have pulled this economy back from the brink.
I had no idea that unemployment went up to 9.7%, that we've lost nearly 4 million jobs, that the government has quadrupled our debt, and that foreclosures are on the rise, and we may have a double-dip recession. I know apparently it's all better.
Yeah, it's amazing. He sees things that most economists don't see yet. Of course, Sean, you and I know that this economy will rebound. It will do that. What goes down comes back up. And it's not thanks to the government. It's thanks to entrepreneurs and working families and people across the country who consume. It is thanks to the American individual. And somehow for Barack Obama and his Democratic allies to say, look what we did, reminds me of the kid that thinks that he's responsible for the sun rising in the morning. It was embarrassing to have him say that. I think those were words that were ill-chosen.
Oh, I think so as well. Now, look, the other thing the president says, he says, look, these are the facts as he lays them out about health care. Nobody disputes them. Now, first of all, I think there's a huge dispute on whether or not abortions are going to be covered, about whether or not illegal immigrants are going to be covered, whether or not they're going to cut Medicare, as was proposed in the House bill, what end-of-life counseling is all about, and his statements that this is somehow not going to increase the deficit at all. I think there's a lot of facts that are in dispute.
Well, I think you're right. You have to tip your hat to the president because he, like Republicans, believes that we need to have reform in our health insurance markets to make sure that a whole series of unfair items don't occur. We don't want people losing their coverage at the very time they get sick. We don't want people to be denied coverage because they have a pre-existing condition. We can agree on those things. But what we can't countenance is when he falls into fantasy land and starts saying things that we know are simply not right. When he says, for instance, that we're going to have a $900 billion health care program, but it won't add to the deficit, we know that's fantasy. When he says that we can take $500 billion out of Medicare, but it's not going to affect Medicare recipients' benefits, we know that's fantasy. When he says that the public option is to make sure people get competition when they're looking for insurance, we know that's fantasy because we have over 1,000 insurance companies, and if he would simply let insurance companies from one state sell product in another, we have plenty of competition. So he's hoping that by virtue of his eloquence, he's going to convince people of fantasy. I don't think it'll work.
Well, let me ask you about the overall state of this. I think that in a week or two we're going to see this speech as a failure. I thought this was basically a cut and paste job from the president's previous, 110 speeches that he had already given and town hall appearances on behalf of Obamacare. Where do you think the debate goes from here? Joe Biden is saying they think they get this thing done by Thanksgiving sometime.
It's hard for me to count the noses, but of course, he does his best to say this challenge that he faces in the Congress is all due to Republicans. But in fact, as we all know, he has all the votes he needs, both in the Senate and in the House, among Democrats to do whatever the heck Democrats want to do. And his challenge is not with Republicans. His challenge is with Democrats who are listening to their constituents across the country that say that they do not want to see the socialization of our healthcare system. And they know that this public option is nothing but a Trojan horse for a single-payer government-run healthcare system. And so, his problem is with his own party and with the people in his own party who are listening to the American public. That being said, I think he's going to have to retreat on the most onerous of the provisions he's describing, which is this public option. It's no option at all, obviously. It is a command that we have a government insurance plan which over time grows and expands to get to where he originally said he wanted to reach, and that was a single-payer government-run system.
Well, and I think that's the naivete that's out there. I mean, once the government has all these mandates and dictates to the free market, especially to private health insurance companies, and once they offer a government option, and they decide, for example, who gets covered, what specifically must get covered, what gets charged, you indirectly are nationalizing the healthcare industry and literally regulating them into complete subservience to the state. In other words, I think in that case, the insurance companies cease to be private.
Yeah, I think it's very difficult for a private insurance company to stand up to a government competitor, a government which right now has 50% of the purchases of health care in this country. Don't forget, the federal government pays for 50% of the health care in this country. And so it's this huge, almost monopolist player. And then for it to say, okay, we're now going to get in competition with all these little not-for-profit as well as for-profit insurance companies around the country, they recognize an unfair competitor when they see it. And they also know that the government steps in and tells them what they must offer in their policies, how they must provide them to their various beneficiaries. And as a result of that, they know the competition is going to slowly but surely have the government take a larger and larger share of the population legislation to the point where they finally get where those Democratic congressmen and senators last night burst out in cheers and applause, they get to the single-payer system that they've long been pining for.
Well, what do you make of the fact that, he keeps saying this is revenue neutral, that he's not going to raise one penny, et cetera, that he's all these promises, all these people are going to be insured, et cetera, when the only bill that we have to look at now is the House version, which in fact the CBO scored, that says, listen, we're talking about trillions of dollars over time.
Yeah, it really is fantasy. I mean, clearly what he's planning on doing is saying, well, health care would grow at, let's say, 4% or 5% per year, but we're going to get it to grow at 4.8% instead, and therefore we're saving all this money. Well, it's not savings. We've got to rein in the cost of health care regardless, and what he's doing is adding dramatically to the cost of our health care in this country. He is not eliminating programs. The only way I know of to really save money is to eliminate programs, and he's not doing that. He's adding one, which is almost $1 trillion program, and given his $1 trillion stimulus plan and his takeover of so many other businesses in this country, he is fast putting the country on the same track that a lot of consumers were on, where we'd over-leveraged ourselves, over-borrowed, and found ourselves in distress.
Let me ask you about the economy, because that's your area of expertise. I guess you worked at Bain Capital. How long did you work there?
About 15 years.
All right, so you know a lot about Wall Street, you know a lot about economic systems, you know a lot about the dollar, interest rates, inflation. I mean, that was a big part of your business all those years?
It was, and 10 years before that I was with a consulting firm. My life has been in the private sector, obviously.
Okay, these are the recent economic headlines. 1, Senate raises debt ceiling above $12 trillion. China alarmed by U.S. printing money. UN wants a new global currency to replace the dollar. And by the way, another headline was Geithner is open to a new global currency that is run by the IMF. We have bank CEO predicting 1,000 bank failures in the next 2 years. Obama, we know, was off by $2 trillion from his projections just, in terms of the deficit, just 6 months ago. And we have a Congress that just gave their staff big bonuses and pay raises. And by the way, they did spend money for hookups to discover the hookup patterns of female freshmen at Syracuse University, which I'm sure every taxpayer is glad to hear about.
It really is sad, Sean. This is a critical time for our country. We do, exist at a time when the economy is very troubled, when it's very fragile. We have come back from the precipice to a certain degree, but we could find ourselves back on it again. And the president's excessive spending and borrowing has put our economy in a far more fragile state than had he been more careful and circumspect in the way he spent money. And unfortunately, his stimulus plan, the almost $1 trillion plan, had some good parts and a lot of bad parts. And at a time like this, you cannot afford the bad. He's made a number of critical mistakes. We can all hope that the entrepreneurial spirit and the hard work of the American people will get us back on track and that the economy will come back. But we have been put in a far more risky position than we needed to be by virtue of the excessive borrowing and spending of the Obama administration.
Yeah, I got to tell you. All right, now, what are your plans politically? I'm not asking you if you're going to run for president again, because I know you're not going to answer me anyway. But more importantly, what are your plans? What do you think is going to happen? We have these races in Virginia for governor and the state of New Jersey where Christie is up by 8 points now. It looks like Bob McDonnell is doing very well in the state of Virginia. That's going to lead into the 2010 elections. I know politically a lot of people are asking you to travel all over the country on their behalf and raise money for them and et cetera, and campaign and endorse them. What are your plans in the short term?
Well, I'll probably see you, Sean. You'll be there reporting. I'll be there campaigning. I am going to be in Virginia. I've already been there with Bob McDonnell, campaigning for him. I've been also...
When are you going to buy me a steak or something? I mean, and if we're going to be together that much, I would figure at least a steak has got to be in it for me somewhere.
Hey, I'm unemployed. You're the guy with an income these days, so you're going to be doing the buying.
Well, I'll take you to Ruth's Chris. I'll be glad to.
There you go. Well, talking about Ruth's Chris, I've already campaigned for Chris Christie in New Jersey. I'll be doing that again. He's coming to Massachusetts for a fundraiser in a couple of weeks, and I'm going to be helping Republican candidates, conservative candidates across the country. It's not a very visible thing to do at this point. These are state and local races, but they make a difference, and we're building the base to see if we can't take back the initiative in this country and make sure that the principles that have always led America and the kind of capitalistic, free enterprise, personal responsibility principles that have propelled our success are once again leading in Washington.
Well, Governor, it's always a pleasure to talk to you. I know that you have a very busy schedule, but I know a lot of people want to hear your thoughts on this, especially important days after the president's speech like last night. And as always, thanks for being with us. Former Governor Mitt Romney, former Republican presidential candidate, thanks for being here.
Thanks, Sean. Great to be with you.